We tend to navigate our days under the assumption that our conscious minds are in the driver's seat. We make choices, form habits, and steer our behavior. But that conscious awareness is only a tiny fraction of the machinery operating beneath the surface. The conscious mind processes about 40 bits of information per second. The subconscious mind, taking in data from every sensory receptor in your body, processes 11 million bits per second. This massive processing engine acts as a psychological immune system. By the time a child reaches age 7, the subconscious has observed the environment and hardwired specific survival beliefs into the brain. It continuously scans those 11 million bits to decide what is safe and what is dangerous. Our baseline reality is governed by invisible subconscious scripts designed exclusively to keep us alive, regardless of our logical intentions. A newborn begins as a collection of separate behavioral states, sleeping, eating, seeking comfort, that gradually integrate into one cohesive identity over several years. If a child experiences severe, chronic relational trauma, abuse inflicted by the very caregivers they depend on, that delicate integration process is derailed. A young child has no physical ability to fight an abuser and nowhere to run. The subconscious monitors the environment and determines when the current reality is physically and emotionally unsurvivable. Lacking a physical escape, the mind creates a psychological one. It builds an emergency firewall. The subconscious fragments, compartmentalizing the traumatic memories and emotions so the core child can believe the events are happening to someone else. This fragmentation is entirely adaptive. It is a highly successful biological defense mechanism that allowed a child to endure the unendurable. Fast forward to adulthood, and that childhood survival architecture remains active. The separated parts of the self continue to operate independently. Clinically, this is recognized as dissociative identity disorder, or DID. This SCID-D diagram maps DID's core features. The blue identity alteration bubble shows a host managing daily life, while emotional alters hold trauma memories. The orange bubble shows amnesia. Subconscious firewalls cause severe memory gaps. Despite decades of clinical documentation, the disorder faces intense public skepticism. Critics often accuse patients of faking the condition, role-playing, or adopting symptoms suggested by overzealous therapists. Because DID creates a measurable structural change in how the brain processes information, it leaves a permanent empirical footprint. Science can measure it, and those measurements definitively separate genuine patients from simulators. Psychological tests like the MMPI-2 employ a specific trauma index to catch feigners. People trying to fake DID consistently guess wrong. They over-exaggerate the wrong behaviors and miss the subtle, covert symptoms that actual trauma survivors endorse. Researchers have moved beyond written tests to verify the disorder directly inside brain scanners. This PET scan array provides raw biological proof. When an emotional part of a DID patient is triggered by a traumatic memory script, the imaging captures intense, localized activation in the amygdala and other regions associated with acute physiological distress. When healthy, highly suggestible actors try to simulate these distinct identity states, their bodies fail. They cannot replicate the drastic shifts in heart rate, blood pressure, and cerebral blood flow that occur naturally in a traumatized alter. The trauma response is wired straight into the autonomic nervous system. Feigning the distinct neurobiology of dissociative identity disorder is physically impossible. Treating a disorder built on protective firewalls requires extreme precision. If a clinician rushes in and tries to force a patient to confront their trauma right away, the subconscious perceives a lethal threat and violently deploys its dissociative shields again. To bypass this, psychiatrists use phase-oriented therapy. Phase 1 can take months or even years. The entire goal is establishing safety, teaching the 11 million bit subconscious engine that the physical body is finally genuinely out of danger. Once that physiological safety is established, phases 2 and 3 begin. The mind safely processing the locked-away emotions, allowing those divided identities to dismantle their barriers and slowly merge back into a continuous, fluid timeline. Dissociative identity disorder is the architecture of human resilience. It is a subconscious defense system that successfully navigated the unsurvivable, waiting for the moment it can safely become whole.